Dear students, dear colleagues, we continue the psychiatry lectures from the University of Pécs, 5th semester psychiatry lectures. Today's topic are psychosocial therapies or psychotherapies, general short introduction to this topic. As a definition, we can say that psychotherapy is a treatment of mental problems by psychological methods. A very important characteristic of psychotherapy is that there is an agreement with the patients that we will work together. The patient needs to know what's happening. The patient needs to have some motivation to change. The patient needs to have some motivation to reduce the symptoms or to modify somehow his approach toward the world. Very important that scientifically based circumstances are needed. So as the background of psychotherapy needs to have a modern personality theory and a modern anthropological theory. So exorcism is not a psychotherapy because exorcism is existing. Exorcism has some characteristics which is very similar to psychotherapy, but exorcism doesn't have a modern psychological theory and a modern anthropological theory. So we do not see exorcism as a psychotherapy because of this. Psychotherapists should have goals, should have methods, and should have indications, and psychotherapies can be short or longer term. The psychotherapeutic process has different stages. The first is the contact with the engagement with the patient, to develop a rapport with the patient. Then it's very important to do an exploration, to develop, to introduce indications, what to modify, what to change. And the motivation is very important. Therapeutic contract is also important. We should establish with the patient, with the client, what are the goals and what are the methods which we will use. The therapeutic contract can be written or it can be only a spoken way. Both are existing, both are good. In some psychotherapies, the therapist and the client writes down a contract and they sign it. There are phases of therapy as introduction. There is the working phase when most of the work is done, when most of the psychotherapeutic processes are evaluated, and there is a termination phase, and sometimes it is very important to control the patient, to do a follow-up, what's happening to the patient. The first method I would like to introduce are psychodynamic therapies which were based by psychoanalysis. You know that psychoanalysis is an exploration of the unconscious. It was established by Sigmund Freud. And this method has a focus on the unconscious dynamics. A very important focus of this psychotherapeutic method are the early relationships, the early mother-child relationship or the early parental relationships. Very important to deal with object losses, significant persons in the patient life. If they were lost and this was a trauma for the patient, this should be worked through. And other traumas also can be involved in the psychodynamic psychotherapy. Exploration of the unconscious dynamics and the working through of these processes are very important. The most important two methods which were based by Freud are free association and dreams. Free association means that the patient says everything to the therapist which comes into his mind, and he doesn't select what is important, what is not important. But in the free association method, everything is important, and this is called the psychoanalytic basic rule, that say everything which comes to your mind without selecting what is important and what is not. And the other are dreams. We know that dreams are, as Freud said, dreams are the royal road, represent the royal road to the unconscious. And because the dreams and unconscious background, unconscious wishes are explored many times in a symbolic way in dreams. And this is why dealing with dreams is very important in psychodynamic psychotherapies. And this is a famous book by Sigmund Freud, which was published in the interpretation of dreams by Freud. In psychodynamic psychotherapy, there are two phenomena which you have to very much know. One is transference and the other is countertransference. Transference means that the patient somehow projects his early relationships, his early object relationships onto the therapist. So the patient had a dependent relationship towards the mother, and the patient transfers this, projects this on the therapist, and starts to behave in a dependent way towards the therapist. This is called transference. Or the patient had an ambivalent relationship towards the parents, and he projects it on the therapist and starts to behave in an ambivalent way towards the therapist. The countertransference is the opposite. Countertransference are the feelings of the therapist, which can come from the therapist's own personal unconscious feelings towards the patient, or many times countertransference is provoked by the patient. The patient starts to behave somehow, and this provocation, this behavior leads to certain feelings in the therapist, and the therapist can recognize these feelings in the countertransference. And both are very important. The therapist should have a good self-analysis. He should know himself, he should know his weak points, he should know his unconscious problems, and don't let these unconscious problems to interfere with his relationship toward the patient. And otherwise, the therapist should recognize what was projected into himself by the patient, and should recognize that his anger, his boredom, his different feelings towards the patient can come from the provocation which was done by the patient. Insight, interpretation, and resistance are important phenomena in psychodynamic psychotherapy, and corrective emotional experience is also important, which was introduced by a Hungarian origin psychoanalyst, Franz Alexander, who worked in Chicago, and he said that somehow you should recognize how the patient behavior was done during the early years, how it is projected on you in the transference, and you should try to correct it. You should try to behave in a different way how the parents behaved, and by this correction you can make a personality change in the patient. The second psychotherapeutic method is supportive psychotherapy, which means a kind of support of patient in everyday difficulties. The goal is to support reality testing, and there is a famous example that as psychoanalysis, for example, is similar to the antibiotic treatment of bacteriums in certain bacterial infections. Supportive psychotherapy is similar to supportive treatment in viral infections. In viral infections, there is no specific treatment as antibiotics for bacterial infections, but in viral infections, we should reduce the fever, we should give fluids to the patient and take care of the patient, let the patient to relax and calm down, and this kind of non-specific treatment of viral infections is a little bit similar what happens in supportive psychotherapy in contrast to psychoanalysis, which shows similarity to antibiotic treatment in bacterial infections. Stress management is also important. Many times pharmacotherapy is done parallelly with supportive psychotherapy, and they should promote each other, and psychoeducational elements is also important in supportive psychotherapy. The next methods are relaxation and hypnotherapies. In relaxation therapy, with relaxation we reduce anxiety. There is a basic rule we can say that if you are relaxed, you cannot feel anxiety. If you are anxious, you cannot relax. And this kind of discrepancy is used in relaxation therapy with altered states of consciousness, with different methods which can be used in relaxation. you can support meditation and imagination, and in the relaxed state you can approach the patient inner feelings, the patient inner unconscious world by using the relaxation techniques. And hypnosis is also a very similar method, which means an altered state of consciousness, and the unconscious contents can be approached, can be explored by this in this hypnotic altered state of consciousness. We know that hypnosis has a very long history from the 19th century. It was introduced by Charcot, Bernheim, and Janet and others, and it very much influenced Freud to develop psychoanalysis, because hypnosis was the first which recognized that there is an unconscious world of the patient which is under the conscious part of the personality. In behavior therapies, we focus on the behavior of the patient. In behavior therapy, the most important message is that, psychiatric symptoms, behaviors which are connected to psychiatric problems are based by maladaptive learning, and this maladaptive bad learning should be modified with good learning. And what are the methods of the good learning? These are gratification, if you behave well, and punishment if you behave wrong way, and this is the main background of behavior therapies. In behavior therapies, black box means that the therapist is not interested in the unconscious world. The therapist is not really interested in the inner world of the patient. What the therapist is interested in, how the behavior can be changed. And there are some methods which we have already touched during the anxiety lecture, as systematic desensitization, when step by step we try to modify, we try to reduce a maladaptive behavior. For example, patient has agoraphobia and not able to go into an open space, the department store as the arcade, and step by step, corner by corner, week by week, we approach the patient towards the arcade, and after 2 months, the patient in hypnosis or in relaxation or in imagination or in reality can go into the department store, and the agoraphobia, which was the symptom, can be solved by this way. The opposite is the flooding, when we push the patient into the stressful situation. Somebody has a fear from traveling, and we put the patient into an intercity train, and the patient cannot take off and needs to tolerate the stress, and it can reduce the maladaptively learned phobic behavior. And aversive conditioning, also an important technique. We somehow punish the patient if the patient does a maladaptive behavior. You have learned disulfiram, which is a medication which has an effect that it blocks acetaldehyde dehydrogenase, and if a patient drinks alcohol and the patient takes disulfiram, it leads to an acetaldehyde intoxication. And in patients with alcohol dependency, with alcoholic problem, we can teach the patient that they should take every time disulfiram, and the patients will not drink because they fear that a kind of punishing, an aversive reaction will come if they drink beside the disulfiram treatment. So this is a method which we call aversive conditioning. In cognitive therapies, which was introduced by Aaron Beck, we identify cognitive distortions, negative cognitive views, how badly the patient views the world, how the patient badly views himself, and how the patient badly views the future. These three is called the Beck triad. So negative view on the self, negative view on the environment, and negative view on the future. This is the Beck triad, which is very characteristic for patients with depression. And this cognitive Beck triad should be restructured, and the negative thoughts should be devaluated by different methods. The patient can be taught in cognitive psychotherapy that he has a black glass, and everything, he looks everything through a black glass, and the world, himself, and the future is not so dark as he is saying. The next method is the client-centered therapy, which was introduced by Carl Rogers. Rogers identified 3 very important therapeutic effects, or 3 very important therapeutic characteristics which the client-centered therapies should have. But generally we can say that every medical doctor should have these characteristics: tolerance towards the patient, congruence, to be who you are, and empathy. These 3 are very important characteristics, should be very important characteristics, not only of the Rogersian psychotherapist, but every psychotherapist, every psychiatrist, and we can say every medical doctor should somehow approach these 3 characteristics. And in the Rogersian method, the reflecting attitude, very important. The therapist should promote spontaneous progression, and there is a focus on the here and the now, and not in the past. In psychoanalysis, there is a focus on the past. In the Rogersian psychotherapy, there is a focus on the present. Family therapy, which is also a very important method. There is a system approach in family therapies. We do not see family members as individuals, but we see family as a system. And there is the process of delegation. When a maladaptive pathological family structure delegates, send somebody as a patient. For example, there is a maladaptive family and which delegates adolescent girl with anorexia nervosa symptomatology. So this is what we mean by delegation. And many times the family therapy should focus on the improvement of family communication, and transgenerational effects are very important in family therapy. The identification of transgenerational effects, that from generation to generation, unconscious contents, unconscious secrets are sent from generation to generation. What the grandmother had done is unconsciously is transferred from generation to generation. What happened, for example, during the Second World War, during the Holocaust, and it works as a secret in the family, not mentioned, was forgotten, and these kind of secrets, these kind of unconscious hidden meanings are sent from generation to generation, and these can have a pathological effect on the working of certain families. And in the case of anorexia nervosa, psychosomatic illnesses or addictions, we can identify these kind of transgenerational effects. And this is a book by Iván Vöszörményi Nagy and a colleague. The title of the book is Invisible Loyalties, which works with these kind of transgenerational hidden contents. The next is a method which I would like to shortly introduce is family intervention, which means that typically in schizophrenia, among the family members, a special approach towards the patient can be identified, and this is called expressed emotion. Expressed emotion means that there is an high expressed emotion means that there is an over-involvement towards the patient, and there is a critical attitude toward the patient. The parents, the family members tell everything the patient what to do, and they are hypercritical. They continuously make critical comments on the patient, and this over-involved and hypercritical attitude towards the patient means a high expressed emotion level. And we know from many studies that if there is a high expressed emotion level in the schizophrenia relatives, it leads to more and more relapses. With the same medication, there are more relapses of the schizophrenia symptoms compared if there is a low expressed emotion level. And the goal of the family intervention to decrease the expressed emotion, to teach the family members that the patient behaves sometimes bizarre ways, the patient shows different, not acceptable behavior because he is ill. And we should teach the family members that he is, in quotation, he is not bad but mad. It's not nice to say, but this is what we have to learn more cautiously to the family members, that the reason that your relative behaves not in a non-acceptable way, that he shows the symptoms of illness, and not because he's an antisocial person or he's somebody who does something wrong intentionally. And group therapies, the group is more than individuals together, and in group therapies there are special group dynamics which can be identified, and Bion, a British psychoanalyst, was who identified so-called the basic assumptions in group therapies, which he called the dependency, that, for example, in groups, certain individuals shows dependency towards the group leader, the group therapist, or fight and flight, that between certain group members a kind of fight appears and somebody attacks psychologically somebody who tries to escape from this situation, or pairing or space goating. These are very important basic assumptions beyond identified. Groups can be small, which means that the group members are from 6 to 15, or large groups where everybody in the hospital is involved in the therapy, in the group therapy. And the background, the psychological background of group therapies can be psychodynamic, behavior therapy, or client-centered approaches. Psychodrama, which was introduced by Jacob Moreno, is very important, also important and very useful method. Psychodrama means that certain patients or certain clients are gathered in a group. Usually there are 8 or 10 people in the psychodrama group, and they play something. They play, for example, a dream of one of the group members, or they read something in a newspaper, a short news, and they play. They make a theater, they make a kind of drama, they make a kind of happening from the short news which they read in the newspaper. And interesting, what you see here is the Barbara effect, which was introduced by Moreno. Moreno worked in Vienna in the beginning of the 20th century, and he worked in avant-garde theater movement work, and which was called the theater of improvisation. And here, what Moreno detected, that they once read a newspaper news that a prostitute was found dead somehow in a suburb of Vienna, and they, with the group members, made a story, made a drama, made a short theatrical play from this short news in the newspaper, that there was a prostitute, there was a client, and the client killed the prostitute because of the prostitute's behavior, etc., etc. And there was a very shy, withdrawn group member who played the role of the prostitute, and the prostitute's name was Barbara. And what Moreno detected, that step by step, day by day, week by week, the shy and withdrawn, personality structured, group member started to change her behavior. He became more open and more aggressive, more hostile in everyday communication. And Moreno recognized that somehow putting somebody into a drama situation, if you let somebody or force somebody to play something which is quite opposite to the player's personality, it can change the personality. And this is what happened to this group member, and this is what Moreno called the Barbara effect. And there are phases of psychodrama warming up, and they start the meeting and they somehow make conversations with each other. There is the playing part, there is a playing of a certain act, and there is a discussion part. There are difficulties of cooperation and their treatment in medical practice. We know that many patients have problem with compliance, have problem with adherence, and in cooperation in treatment in medical practice, there are some ways how to influence this bad compliance or this lack of adherence. And one is psychoeducation, when we teach the patients how to be more compliant. We teach the patients what is the illness, that you have diabetes, then it means that there is not enough insulin, and this is the reason that you should give everyday insulin injections to take care of your blood sugar levels. Or you have schizophrenia, which is somehow connected to the disturbed level of dopamine in your certain central nervous system, and the drugs which helps you are stabilizing the dopamine levels, and this can be educated towards the patient, and this is the focus of psychoeducation. And there is another method which is called motivational interviewing, when reflective attention towards the patient is very important. There is an empathic way towards the patient which is very important, and there is a way how in motivational interviewing we try to increase the patient compliance and adherence towards treatment. And the most important method in this motivation phase is somehow to show to the patient that there is a discrepancy between his positive goals. For example, a psychiatric patient doesn't want to get hospitalized again and again, and between the maladaptive behavior that the patient is not willing to take his medication. So, and there is a discrepancy between the two. And if we try to teach the patient during the motivational interviewing technique that between the positive goals, that I don't want to get hospitalized again into a psychiatric department, and between the maladaptive behavior that I don't need drugs, there is a discrepancy, then it can lead to the changing of the behavior, it can lead to the improving of compliance, that the patient will cooperate better with medication to realize his goal, to not get hospitalized again. And this is a special technique which is very useful in many fields of medicine and very useful in psychiatry too. Rehabilitation is somehow to reintroduce the patient into real life. For example, in occupational therapy, the patients are working, the patient in a supportive workplaces has the possibility to work, and this is very important to get back to the roles they lost during the illness. Non-verbal psychotherapists should mention art therapy, music therapy, and dance therapy, which somehow promotes the patient contact with others, and an exploration of their inner world is very important. And cognitive remediation, which means that there are some cognitive dysfunctions in certain psychiatric illnesses, and with repetitive practice you can somehow improve the lost cognitive capacities. And in traumatic brain injury or in schizophrenia, this cognitive remediation is a very important technique, for example, to somehow to increase the patient's memory capacities or attention deficits should be corrected by this way. And with this, I would like to thank your attention, and this short summary on psychotherapies are important because they are very much related to the illnesses which we have dealt during the first semester in our education. So thank you very much.